Hello, everyone. Welcome to episode 5 of Corner Studio Sessions. I'm Jacqueline.
And I'm Allie.
And today we are going to talk about all things laser.
Perfect. So here at Corner Studio, we have Morpheus, Diolaze, and Lumecca. Tell me briefly, what is that?
Perfect. So we'll talk a little bit about each of those. Before going into that, we have always loved the InMode family. So that is who makes each of those machines. So we'll talk a little bit about those.
Perfect.
Morpheus is a microneedling radio frequency. So if you've ever had regular microneedling before, that is where there is little needles out of a pen that penetrate the skin at like 1 to 2 millimeters and doesn't use any heat or radio frequency. So some people are more familiar with that.
Yeah, just
the Morpheus
regular.
has some different settings and also has the heat component and the radio frequency, which kind of make the results from that a little bit stronger than regular microneedling.
Better, more enhanced.
Yes.
Yeah.
So briefly talk about each and then we'll go into deeper. The Lumecca is our IPL. So if you've ever heard about a device that helps with like brown or red pigments, that is our go-to for those guys.
Yep.
And then the Diolaze is our laser hair removal.
Yep. Perfect.
So using that a lot right now in
Before
winter,
summer prep.
Yeah.
Yes.
Getting everyone ready.
Definitely.
So let's dive into each of one of those.
So the Morpheus8, even microneedling in general, can be very intimidating, especially to those who are a little nervous about needles. How would you go about telling someone that is very, scared? Like, how would you tell them about the service and why they shouldn't be nervous of, pain?
So we've had the device for 3 or 4 years now. We got it a year or two after we opened, and
I think it's going to be 5 this year.
5?
You guys will be open 6 years in October.
And we got it a
year after.
All right, 5 years.
Wow.
So when we first got it, we were trying to figure out the pain, comfort, and stuff like that. But basically, a lot of clients, they come see me for more of the injections, and then they'll go over to the estheticians for the services that we're talking about today. But I kind of start planting the seed of those services to the clients. So basically, I give them a brief description. We've found a really good spot for the amount of numbing. So we found the right amount of numbing topically. It's
perfect.
Yes.
Numbing cocktail. Yeah.
And most people do really well just with the topical numbing. However, we do have the Pronox, which is laughing gas. Most people may have experienced that at the dentist. That kind of just takes the edge off if they're still feeling a little uncomfortable after the topical numbing.
Perfect.
But the combo of those two, I feel like people are really comfortable. I don't feel like there's issues.
Yeah. Once we got the Pronox, the comfort level just increased.
Yeah.
Almost to where it's just comfortable.
Yes.
So that's perfect.
So always an option as an add-on.
Yeah. Perfect.
So we talked about what it's doing in the skin, but who would you say is a good candidate for the Morpheus?
Really, everyone. I would say the only person that maybe might not be a candidate or where we just have to be very cautious is someone with melasma.
Melasma.
Your favorite.
Darn melasma.
But yeah, and you do have to be a little bit more cautious with darker Fitzpatrick's, but really everyone, because it can be, the settings can be tailored to that person's specific skin type, anatomy, all of that to get their desired result. So I would say everyone, even younger crowds, older crowds, in between. Yeah.
And then it's typically recommended in a series. So typically you'll go to the girls, you'll get your first session, you'll wait about 5 or 6 weeks, and you come for your follow-up.
So why do we recommend a series of 3?
The best results. So your collagen starts to build, but it's just building up a little bit at that first session. We want to get it all the way up as far as we can go.
Think about, let's say, a 50-year-old, and you start losing collagen at 25 years old. That's 25 years of the collagen depleting. So we can't go back in time, but we're just kind of trying to catch up. So honestly, the more treatments, the better, and really depending on the desired results. But always a series of 3 for best results with
For best results
yeah.
and for correction, I always tell people too, like, you're better off having one than nothing.
None.
You're
Yeah.
doing something. But if you're looking for an area that you want to correct, you definitely want to do a series.
Yeah. And also that kind of sweet spot, and everyone can rebuild collagen differently, but it does take sometimes up to 12 weeks to see the result of just the first one. So coming in every 4 to 6 weeks will just stack the trauma and collagen building for best results too.
Perfect.
Yeah.
And then, like we've talked about before on the podcast, we do have our Visia machine, which we will. What is that?
I don't know.
Things. So we do have our Visia machine, which we will put people in before they start their series. So then
Yes.
you can see your progress as you go along.
Yeah, I love that device. It kind of covers our butt sometimes. Someone will be like, I don't see any result. And then you're like, boom, look at this.
Yeah.
Because you see yourself every day.
Yeah.
So it's
Sometimes
very
you
hard.
just got to see it.
Yeah. And, it's the angles the same, the lighting, all of that. So that's really the key.
What is our favorite thing to put on after the Morpheus for
Oh,
recovery and skin quality?
oh, PDGF. For sure. For sure. So not only is that going to accelerate healing time, it also is going to amplify the result. So, kind of, I guess the simplest way to put this is be like, let's say you cut your knee open. Gets itchy, dry, scabby. That PDGF, it's very hydrating. And it also is going to communicate with the wound healing factory, collagen, all of that to kind of speed things up. And it's just like an extra helper. So it's really just going to do a lot more. Me, I don't want any downtime. I want all the results with no downtime.
Yeah.
That's why we do it.
We used to do PRP, which would require a blood draw and, all of that.
Yeah, poke and...
Now we just do the PDGF and it's pretty seamless.
So, but why now are we doing the PDGF over PRP?
Good question. So PRP, we have to take into consideration the patient's hydration status, age, all of that.
Diet.
Where the PDGF kind of sounds a little scary to some people, but it's done in a lab, the growth factor. So we know it's like the best sample. So we don't have to worry about
top quality.
Yeah.
Yeah. That's perfect.
Talk a little bit about, so we'll talk about the Lumecca, which is the IPL, which corrects the brown and red pigments. How would you go about if someone came in to see me and I recommended both, about how you can do them both on the same day and what that looks like when they come in?
So I love stacking treatments. I feel like the results are even better as well. But so I always do the IPL first. One, because I don't numb prior to IPL due to like the vasodilation with the lidocaine if we are treating reds. And then also the ultrasound jelly. So I wouldn't want to be slapping that on afterwards. But yeah, we can do the IPL first. And then I throw the numbing cream on for about like an hour and then go right in with the Morpheus. So that IPL is going to be pulling up that pigment, collapsing those little capillaries, blood vessels, and then the Morpheus will be like adding the collagen, elastin, that controlled wound. And the IPL does also stimulate collagen, elastin too, so that even helps as well. I feel like it gives a really nice plump to the skin.
And why have two different downtimes if you can do it in one session? There are some patients that don't qualify to do those treatments on the same day, but that's, we can cover that in a consult.
Some rather just split it up too because they're nervous, and we can do that as well. But if we can get it done the same day, let's do it.
Yep, perfect.
Yeah.
Okay, so going back to the Lumecca, we talked about how the Morpheus, it's the little needles on the device that go and penetrate the skin that helps with collagen. But what exactly does the Lumecca? Like when you're doing a treatment, explain to everyone.
Yeah,
Is
like
there
a little
needles?
breakdown.
Yeah.
So it's not a needle. It's like I believe it's a crystal. It's like a little rectangle. So we're not breaking open and going like through the skin, but the laser's chromophore target is to reach the pigment, the melanocyte, grab it, pull it up to the surface. And sometimes pigment is very stubborn and doesn't do that. It's also why we need to do a series of 3. But really what it's supposed to do is lift it to the surface to where it can just flake off. So really the downtime's a lot less, but you will get those coffee grounds. So the pigment will darken because we want it to flake off, but it's really easy. And then IPL stands for intense pulse light, so it's very, very bright. But you do obviously wear eye protection, but that light still gets distributed throughout the tissue as well. So it's very everyone. I always do a test spot. Everyone always whoa, not because it hurt, just because the light is so bright. It's
Right.
like a little jump scare. But then once you get used to like what it feels like, what it is, and it's really not that bad. Some people, if you have a ton of pigment and there's more for that laser to pull up and grab, it can feel more like a rubber band snap. But it also has a cooling mechanism on it as well, so it's really cold. And so is ultrasound jelly. So I'd say lots of cold, bright light, snappy, but it's really not that bad.
Yeah, it's pretty tolerated, which is why, like you said, we don't use the numbing cream for that procedure.
Yeah, and really because it's not needed,
Yeah,
I would say.
definitely.
Yeah.
I think the cooling mechanism in that device and the Diolaze, which we're going to talk about, makes ours a little bit different from others and more tolerated for the patients.
Yeah, I agree.
And then the last device that we want to talk about is the Diolaze, so our laser hair removal.
Yes.
So how many sessions? You're doing a consult, people have questions. What do we cover at that?
So I always do a minimum of 6 at least. Might need more. The 6 might just do it, but rather, cover all those bases first and do the 6. We can do anywhere on the body, like literally anywhere, which is really nice. So wherever you have hair that is dark.
Yeah,
the hair has to be dark because the chromophore is pigment similar to the IPL. So the pigment of the follicle is what the laser is targeting.
So blonde, gray, white. It's not going to pick up any of those pigments.
Unfortunately, no, because I can't do it.
That's sad.
I know.
I'm sorry.
I'm hoping like as I age and like hormones, like my hair gets dark so I can laser it off. But so have to be dark. And then that, like you said, cooling mechanism. So that's super, super comfortable.
Yeah. I don't know if people have had it before and they've had a bad experience, but our device is just very comfortable.
Yeah.
I can go in there, you can do my legs, and I just sit there and it's perfectly fine.
Yeah. And some people, are a little bit more sensitive or have a lower pain tolerance, but still it's so worth it. It is so much more comfortable than waxing.
I will say that. So my hair is probably like medium, right?
Yeah.
The very dark, thicker hair.
Yes.
Males, they're going to feel it a little bit more.
Yeah, it'll be more snappy.
Yes. Which we can use the Pronox if someone is uncomfortable.
If
just
needed.
like we did for the Morpheus.
Like your husband.
Yes, Scott likes the Pronox.
A lot of people do.
A
Yeah.
lot.
So it just takes the edge off. But like you said, he is a male. He has darker, coarser hair. So it does hurt a little bit more.
Yep.
But,
so you said at least a series of 6. By the first one, people are going to start to get, less and less. You have to wait for that next cycle of hair growth, obviously, to hit.
Yeah.
To get.
So sometimes even after the first one, because we do it every 4 weeks, sometimes after that first one, they're like, I barely have any hair growing. And that's great. But that doesn't happen for everyone, because the reason we need so many sessions of laser hair removal, because the hair follicle can only be destroyed, aka killed, in the active growth phase.
Yep.
And there's 3 growth phases in the hair follicle, and every single individual hair follicle is in a different phase. So that's why we need so many.
Yep.
Yep.
For sure. And then, it's a good time of the year to do it because we can't do that service, say on a female if they've been in a bikini and they want to do like their bikini area because the sunlight has been
if
hitting
they've been like out in the sun, like very dark tan, sunburnt. Yeah, no, we can't do it. We would have to wait.
Goes for all the lasers. All right, so should we cover some misconceptions that sometimes people look up on the internet and come in and are like, wait, what? One that I want to talk about really quick is the Morpheus. So a lot of the times when people come in for like a injection consult, they have been looking on the internet and they're worried about what the Morpheus does with removing fat and like areas that we wouldn't want to and stuff like that. So mostly I'll go over that, everyone here is trained to go over certain depths of the face. Like we wouldn't want to take go really deep on the cheek
Mhm.
on someone who doesn't need fat loss there.
Mhm.
So
Yeah,
just
definitely.
knowing how to use the device
Very
is very
important.
important. And maybe someone had a bad experience and wrote something on the internet because they went somewhere that, was maybe doing the same setting all over or
Yeah,
something
just
like that.
wasn't, properly trained or they just don't know.
Yeah.
Yeah, and that's okay.
So I would say maybe just come in for a consult before
Mhm.
if you have any questions about anything like that.
Yeah, and I would say I think the only other one that I can think of right now would be that laser hair removal can make the hair, like, stimulate more hair growth.
Mm. People come in asking that?
Yes, because I just saw on TikTok someone being like, "Do not get laser hair removal. It caused me to get more facial hair." But you really, no, that shouldn't be happening because it's targeting the follicle to destroy it. But I always tell people, like with PCOS, hormonal conditions, hair growth, the follicles, they grow off some hormones like testosterone. You can get new hair growth. So if they're doing like starting a new medication or doing like hormone replacement therapy, or they have something like PCOS, we're going to have to keep doing like those maintenance treatments. It
Mhm.
won't make it worse.
Yeah.
So,
Even if like you have a pregnancy
yep.
and you may have
Pregnancy.
completed a series, sometimes you might need some touch-ups after
Mm-hmm.
that.
Definitely. Yeah.
Perfect. Anything with the Lumecca that maybe people.
I mean, the only thing with Lumecca is it can actually only treat Fitzpatrick's 1, 2, and sometimes 3. So, like, think of like Fitzpatrick 6. So, like, someone who's African American, they have all dark pigment.
Mhm.
So if I
Yeah.
put that laser on there, pull the trigger, it will permanently remove their skin color.
Yeah.
That is not good. We
No.
don't want that.
No.
So yeah, I would say that, and that has happened. Not to me, but like I've seen it online just from people using like an IPL device untrained and not knowing what they're doing. But I would never do it.
So they might just be someone that's more skincare, peels,
Yes.
stuff like that
Yeah,
instead of
or
lasers.
Morpheus, the hydroquinone, yeah,
Mhm.
stuff like
There
that.
are options.
Other options,
Yeah.
yes, but yeah, so just yeah, I would say just who you are treating with that IPL, you do have to be very careful. And since it is a light laser, we have to worry about like photosensitivity if they have been in the sun, have any tan at all to their skin, if they're on like doxycycline, stuff like that. So, yeah, I mean, bad things can definitely happen with anything, any laser, any medication, but just knowing what you're doing.
Mhm.
Yeah.
It is definitely a process here, like all the lasers. It's kind of a series. You're coming in for multiple appointments. So we're here throughout the whole process. We
Yes.
have aftercare to give to you guys to keep
That's very
everything.
important.
Yes.
Ooh, let's go over that. What is
Conditioning the skin before.
Yeah, before, what does like our pre and post care look like?
Yes. Good. So we start with the Visia, take the pictures.
Mm-hmm.
For the Morpheus, you always want to be on a retinol. So that kind of conditions your skin, gets it ready because it is such a intense procedure
Yes.
to make sure you can tolerate it. If you went straight to the Morpheus without having any medical grade skincare, your healing time would just, your skin wouldn't do so well.
Yeah, you might be redder for longer. It's just not preconditioned, so it just takes longer to heal. What is your favorite retinol that you like to precondition with?
Well, I always like to say that my skin is sensitive. I know that's not technical, but I'm
It
more
is.
dry. I'm dry.
So it's
In the winter, I'm dry. So I like the Alpharet. It's just very gentle. I've tolerated it better than other products I've used in the past.
Alpharet always. That's the go-to here.
Mm-hmm.
And then post-procedure, we have Epicutis. So we give you a cute little sachet.
Mm-hmm. Little baggy.
Yeah, of an oil cleanser, so it's like super hydrating, and lipid serum, which is like liquid ibuprofen, and the Hiveo cream, and Epicutis. It's EWG certified, very minimal ingredients, very hydrating, skin barrier focused. So it's really ideal post procedure because there's no fragrance, dyes, any of that jazz. So yeah,
Would definitely recommend the PDGF after to kind of get a jump start
yes,
on the healing, get that, growth factor in.
and it will enhance your results.
Yes,
So
for
who
sure.
doesn't want that?
Definitely. And then for all these procedures, you get an email with pre and post care instructions. So
Mm-hmm.
we'll always go over it with you. But if you forget, you can always check that to kind
Mm-hmm.
of
Yeah,
a go to.
yeah. 'Cause sometimes I don't know about everyone. Me, I can go over a lot, and I know they're gonna walk out and be like, "I don't remember anything she said," and that's okay, but that's why we have the paperwork that is sent pre and post procedure, so you have something to look at, or, you can always call too.
Perfect.
Yeah.
So if you have any questions or are curious about lasers, come on to Corner Studio and come have a consult with us to see how we could help you.
Yep. Perfect. Thank
Thanks
you
for
so much.
listening.
Yes.